Back pain. This episode is Jeff Cavalier, very famous strength and conditioning coach and physical therapist. He's going to be discussing how he goes about treating lower back pain.
And we are two doctors specializing in spine and sports medicine, and we're going to find different ways that we look at it, but how they are complementary to each other. So let's see.
Let's roll it.
If you've got back pain that you can literally put your thumbs right on, I'm going to show you how to get rid of that today, and more importantly, give you a strategy for making sure it does not come back ever again. What's up, guys? Jeff Cavalier, AthleanX.com, here with Jesse and Raymond. If you're looking for a way to get rid of that back pain, and I'm talking about the type that you can literally put your finger right on, right, where you can feel it, and sometimes even by putting your finger there, it shoots pain down into your butt too. There's something you can do about it. You need to first of all start identifying what it is though properly, because it really isn't low back pain. We're not talking about the muscles here or the low back.
So he's pointing to the posterior superior iliac spine, which is also called the PSIS. It's the most common place that people get what we would call lower back pain. It's true, it's not over the lower back muscles, but from a medical doctor's perspective, we certainly would classify that as well as buttock pain. All of that goes under back pain to us because the underlying originator of pain in that area is usually coming from the lumbosacral spine.
Even though you might feel some of that pain up there, really what we're talking about is a glute medius. And this is a rampant problem, and one that is caused by a lot of sitting and a lot of things that we're maybe even doing wrong in the weight room. But first of all, we want to make sure that we're all talking about the same thing. And right here, if you look on Raymond, the glute medius is this muscle that runs right up under here, okay? It's actually underneath the glute max, and it attaches just on the inside of this bony area here that we're going to call the PSIS. Now, why does that matter? Because big bony areas make it really easy to feel and find out and make sure that you're on the same spot. So if we look here on Jesse, if you lean forward, you can then rub your hands across the low back, and you should instantly be able to feel two spots where the bones are sticking out. And that is exactly that same area that I just showed you on the skeleton. If you're running your fingers just to the outside, and that's where you get all that increase in pain and tension, then we are talking about the same thing, and this is what we're going to be able to take care of right now. All right, so what's the muscle supposed to do for you anyway? Two things. The first is you should be able to use it to abduct your hip, meaning to lift your hip up and out to the side. The other thing that's even more important is that with every step you take, its job is to make sure that your pelvis stays level. Because we know that when we lift one leg, the body wants to fall in that direction, meaning the hip on this side wants to fall out this way, right? So it wants to instead, if the muscle's working right, keep your pelvis level so that it's not doing this. There's something called a Trendelenburg gait that when your hips can't do this, you start to look like, show them, Jesse. Yeah.
So one quick thing, this is absolutely, he's trying to talk about the Trendelenburg, and Trendelenburg wouldn't necessarily look like that because usually only one side is going to be affected, not both sides. So as a person is walking, usually one hip would drop and the other one would stay level. And one other little point to focus on is that when Jeff was talking about the area just outside of PSIS in the muscle area, that could represent a number of different muscles that are affected, not to even start talking about other sources of pain like a disc, like a nerve, but this could be towards the piriformis muscle, towards the glute max muscle, and it could be an irritation of the nerve as opposed to just that glute medius.
Sort of like that, right? But it starts to drop on every step. You don't want that to happen, but here's what's even bigger. If you lift weights and you squat, the problem is I can almost guarantee you that when you start to get this pain at some point, it's because you do not have an equal distribution of weight through both of your legs. And we can test that very, very easily. And you're probably going to be very shocked by what you see. Just stand with your feet pretty much shoulder width apart, like here. Now, when you go, all you want to do is just lift one leg up off the ground. If I lift the left leg, I can do that, okay? Not a problem. If I have to lift my right leg, I have to almost shift my weight too much, a lot more significantly than I did on the other side. If you have to shift your weight, or if you even see that your shoulders sort of move a lot to one side in order to get your weight off of that foot, then you do not have an equal distribution. And what's going to happen there is you're going to cause imbalances that will start to rear their ugly head in the form of this more frequent back pain.
Two things that I love the way that Jeff does things. One is he describes the muscles really well. He describes, the anatomy, the way that you can palpate it really well. And he's describing Trendelenburg gait other than the weird,
That's back and forth.
What do you call it? Swishing back and forth. But otherwise, he's making really good points. Now, with that said, there's a few things. So one is they're talking about gluteus medius pain, tendinitis. From the way that a medical doctor would orient to this, a lot of times muscles will spasm because they're trying to guard from some underlying inflammation, typically from a disc or a nerve or a joint. And one of the ways that you can recognize this is the muscle will spasm, and then you'll do something like sit in a hot shower, take a hot bath, get a massage, and the muscles will relax and it'll feel better for 20, 30 minutes, an hour, and then it all starts to tighten up again because those muscles are really just symptoms of something else going on underneath that. And so that's one of the reasons why just addressing the muscles isn't always enough. The other thing that I wanted to mention though is that Trendelenburg gait is a really common problem. And the two most common reasons that people get Trendelenburg gait is either because of a hip arthritis, which then people favor away from the hip, and then the muscle atrophies, or from a problem in the back, which, especially if it's a nerve, which then doesn't talk as well to the muscle, and then you get weakness and atrophy of the gluteus medius. But anyway,
Yeah.
let's roll.
So, before we roll,
Yeah.
just the test that he just showed, terrific way for anyone who doesn't have this kind of pain to test it out, because that really indicates any degree of weakness in gluteus medius and stabilizing the hips. And that, just like Jeff said, it will rear its ugly head somewhere down the line. This is what we see transforming into iliotibial band syndrome. This is what can affect the way you're running, your gait, your mechanics, and that will translate into something. Now, that something may be knee pain, that could be ankle pain, that could be hip pain, that could be iliotibial band, but that weakness is a pretty common reason for lack of pelvic stability, which will result in other overuse injuries.
100%. And sometimes, to his point, like sometimes you can have a gluteus medius tear or something like that, and that instability in and of itself can also lead to back pain, right? Or to further back pain.
Yep.
Because of the same reasons.
And we can eliminate that. When you squat, you want to have equal distribution. So now the most important thing is fixing the damn thing, right? So if we come down on the ground, I'm going to show you exactly how we can do this and get rid of it right now, and more importantly, some exercises you can do to strengthen it so it doesn't come back again. Okay, so the fix for this is actually pretty easy to do, and most importantly quick, because if you find this and you do it right, you're going to feel relief right away. So you take your finger and you put it, your thumb, you put it right up on that spot, okay?
You're going to draw me like one of your French girls, Jeff?
I can't draw, dude. Let's go. So you put your, what an idiot. You put your thumb right on that spot, okay? From here, now all you're gonna do is use your own pressure from your hand and then move your leg in a certain direction, okay? Now, what you don't wanna do is you don't wanna start reaching for a lacrosse ball and putting it underneath you, because when you're in pain and you're already inflamed, you're putting too much pressure on this area. It's likely to resist what you're trying to do and not help you to fix it, okay? In this case, you want to use the top-down pressure that you can control. So once your finger is on that spot, you're going to take your leg through the same direction right here. You're going to come down until your knee touches the ground, okay? Once it touches the ground, it's going to kick back behind you into extension, okay? It's key that you get past the midline of your body here, and then when you do, you're going to lift up. Okay, your toes should be pointing a little bit down towards the ground when you do, so we make sure that we're getting a lot of hip abduction here.
Yeah, it's really important when you're trying to strengthen the gluteus medius or the hip abductors more generally. You need to get extension in your hip, because if your hip isn't extended, then the propensity is to bring in the hip flexors, which are the strongest muscle in the body, and they overpower the gluteus medius, and you end up basically cheating without meaning to cheat. So you do that hip extension to take the hip flexors out of the picture, and that isolates the hip abductors, which is a really good point.
And also another thing to note is that if you're trying to feel this on yourself, it's very, very difficult. So unless somebody can watch you or record you, you may not pick up the fact that you are cheating without realizing, even if you have the best intentions. And if you just watch the video and you're trying to reproduce it, you may actually be cheating without realizing.
But I think a good way to hold yourself honest is you should be feeling the burn. You should be feeling the muscle working on, in the hip abductor on the outside. If you're not feeling that, if you're not feeling it in your butt, basically, if you're feeling it in the front of your thigh, then you're using your hip flexors.
So then the thumb pushes and holds this back. Now, I don't have to do any of this. This is going to be done all by you and Jesse. You're pushing as hard as you can into that spot. He comes up, he lifts, goes down, touches down nice and slow, back into extension, lifts up, toes pointing down, and every time you feel that, right, Jesse? You can feel it flossing through there. You do this about 10 times, okay? Once you're done with those, you rest for about 10 seconds. And now we want to try to fatigue out this muscle spasm here, this trigger point, okay? Try to see if we can burn it out. You hold that spot one more time. You get right back into this position. So the leg, again, back into extension, toes pointing down, abduct it, and hold it, and squeeze it as hard as you can. In other words, lift this up, squeeze it as hard as you can. Now, one of the interesting, he's groaning over here. One of the interesting things that you're gonna notice is that when you have issues here and you get this frequent low back pain, this muscle is probably really, really damn weak. And this alone feels like agony. You can't even hold it up, even though you, I know people that can squat hundreds and hundreds of pounds that really can't do this exercise very well, and that shows how much pain and weakness there is, right? So we gotta do that. Once you've done that, now when you stand up.
It's a really good point, by the way, that even in people who don't have any injuries or don't have any pain, this is a great exercise to be doing, because we tend to be, as you like to say a lot, we tend to be much stronger in a linear motion, right? Hip flexors, glute, because that's how we move all the time.
Not only the way we move, but we also exercise that way.
True,
right?
Right,
So
100%.
cycling, running, walking, hiking is usually more in a linear, so it affects the front and the back of the leg, so quadriceps and hamstrings, much more than the lateral and inside parts.
Right, and yet our stability comes in large part from these hip abductors and other muscles, but the hip abductors, and they really don't get a lot of workout unless we consciously go after them. But they're so important, which is why you can have this instability sometimes, even in people that are in good shape, and that can lead to other kinds of problems. So this is a really good thing to be. It's a good exercise to be doing, irrespective of back pain.
You should notice an immediate relief. Go ahead and stand up, Jesse. You should notice an immediate relief in the amount of discomfort that you feel in that spot. We've actually gotten rid of that pain for the short term, but more importantly now, how do we keep it away? That's what I want to show you next. Okay, so here's what you're going to want to do to get rid of this pain once and for all. One exercise here is you're going to just use a wall. You put one arm up, just like that. Now that's not meant to push against the wall with, it's just meant for support and balance. You take the leg that's on the inside and you lift it up. Now what that did is it should let this hip just drop out to the side casually, this way. But the glute medius, remember, it wants to make sure that it doesn't drop. So it's going to drive it back in until that leg touches the wall. And then you let it drop out again, and then it drives up and across. So we're actually working this outside hip, the one with the leg on the ground. And you want to do this for about 10 or 12 or 15 reps, but most importantly, make sure you get really good solid contractions here so you're teaching it to get stronger. How many times? You want to do this at least 3, 4, 5 times a week, maybe even just once a day if you have the back pain right now. You want to get to the routine of doing more of this, especially if you're sitting a lot, okay? We have another exercise here that you can do, and this is a little bit odd, but I promise you it's going to work. Okay, so this one's a little bit elaborate, and yes, it's definitely weird. We actually call it what it looks like. It's a sack swinger, okay? You'll see in a second. You just basically take a dog leash, and you take a kettlebell, any kind of a weight here. Of course, this could be a dip belt too, but if you don't have a dip belt, you put it right around here, and then what you're going to do is you're going to step in. So Jesse's going to step into it, and then he's going to hook it around his waist. Okay, just from there. Now it's hanging in between him. Now you know the name. Why I got the name. Now he's going to turn around this way, and all he's going to do is he's just going to start walking and try to maintain a nice, slow, normal gait. And you can see every time he lifts one foot, it's challenging now, not just to try to hold up the weight of that leg that's in the air, but now he's got to control the weight that's hanging beneath his legs too.
These are great exercises. Like we were saying, to increase the stability, I think everyone could benefit from these. He said something, what Jeff said before, I thought was really important to point out, which is that this is how you get rid of a trigger point in the gluteus medius, right? A trigger point is basically a muscle spasm. And the way that we tend to think of trigger points in the medical community is that trigger points are temporary, or else if they're chronic, then they're reacting to something else. So if somebody had acute pain in the gluteus medius, this I think would get rid of it really well. If this was more of a chronic issue, then this might be one part of an overall rehab plan to help unload the back, but I wouldn't be too discouraged if you did this, it worked out the knot, and the knot came back. I wouldn't be too discouraged about that if that happened.
So this is a more advanced version of what we just showed you, but this is going to really start to free up those hips, teach those muscles to be a lot stronger than they are, and more importantly, you do this just a little bit as a warm-up, and you can feel that your low back pain should start to be a thing. He's already It's already burning just from one little walk down and back. Just do it, again, you want to do this in privacy of your own house, that's fine. But I can promise you that this low back pain is going to become a thing of the past. And then finally, the other exercise is the treatment. Remember when we had you lay on the ground and put your finger there? Well, just the movement itself. Bring your leg back behind your body, lifting up, toe down, coming forward, touch the ground, the knee to the ground, come back and do those leg lifts. You do as many of those as you can until you build up your tolerance and your endurance there, and you make sure you do it on both sides. That exercise from the treatment standpoint becomes the thing that you actually want to do to make sure it stays away long term. Okay? Guys, low back pain is one of the most common things that we all deal with, and it can undermine any of your workouts. As anybody knows, when your low back is humming.
Lower back pain is absolutely one of the most common. I think it's always number one or number two of the most common reason that people go and see their doctor. When lower back pain has lasted for more than a couple of months, we understand that really well in terms of the underlying cause, which is, typically disc or else facet joint, or much less common, the sacroiliac joint. That accounts for about 90% collectively of chronic lower back pain. And then what happens when you have pain like that is all the muscles around it start to basically go out of whack. They try to guard, they're trying to protect you, and they become painful in and of themselves. And then, like we said before, you massage them, you work them out with different exercises, and it should feel better for a little while. But the problem is, until you address the underlying irritation in the spine, there's a tendency for those muscles to keep on coming back. With acute pain, meaning pain, let's say realistically less than a month, much more likely to just be some kind of muscle spasm, a small tear, tendinitis. And those in particular, I think, would respond wonderfully to this approach if the pain was in the gluteus medius.
It's really difficult to even get yourself in the gym, let alone to lift anything of significance. We want to make sure we have that fixed.
I think that as you're following along with exercises, I've done Jeff's strength and conditioning programs before. I love them. I think he's really great at it. I love the way that he and therapists generally orient to the back, including in this video where they're really honing in on the gluteus medius. Whenever we're treating patients, we're always thinking of it both from a spine perspective and from the muscular perspective, because you really want to be addressing both, because if there is instability, then in addition to addressing the spine, you're going to want to address those instability issues, or else there's a tendency for the irritation in the spine to come back. So, regardless of how you think about it as a therapist or as a medical doctor, we're all rowing to the same destination. And I think there's a lot that people can get out of this video.
Absolutely. The only thing to think about is not to get frustrated. And if you are working on this, and if you are doing the exercises and it's not resolving, then it's time to consider other sources of the pain, and that may be the driving force behind it. And it's not because you're not doing the right thing or you're not being diligent enough, but you may just not be addressing the underlying source.
100%. We'll see you in the next one.